This is the very first lesson of our professional medical aesthetics training series. It's a complete series. Each video is carefully designed to lay the foundation for the next one. If you're a physician or an aesthetic injector just starting out in this field, or if you've been practicing for years and want to strengthen your fundamentals, you're in the right place. In this series, we'll cover medical aesthetic procedures from A to Z. For every treatment, we'll explore its anatomical foundation, pharmacological reasoning behind it, clear indications and contraindications, the application techniques, injection planning, and complication management. This is not just an injection training. This is a program that teaches clinical reasoning and sharpens your ability to think analytically. We won't just ask, how is it done? We'll ask, why is it done? When should it not be done? And how can it be done better? With the power of knowledge, we will elevate the quality of your practice together. Now, let's begin our first lesson, the clinical approach. It starts from the very moment you see a patient for the first time. And it begins with understanding them. Are you ready? Let's begin. Patients who come in for aesthetic treatments rarely use technical or procedural terms. Instead, they tend to express themselves through emotions or abstract feelings. I look tired. When I see myself in the mirror, I feel old. I look pale in photos. These sentences reveal how the patient feels, but not what anatomical change is actually bothering them. And that's why the very first step in clinical assessment is to uncover the real need behind the patient's complaint. Patient motivations typically fall into a few key categories: aesthetic preparation for an upcoming event, a wedding, graduation, or job interview. They want to look their best for a special occasion. Desire for youthfulness and freshness. Patients who want to address facial lines, volume loss, or dull skin caused by aging. Routine maintenance and appearance preservation. Those who get regular treatments to maintain and stabilize their look. Trends and social influence. Patients requesting certain procedures simply because they're in on social media. As a clinician, your most critical responsibility is to correctly interpret these motivations. You need to evaluate whether the patient's psychological expectations are in harmony with realistic clinical outcomes. Not every request is clinically applicable. For instance, when a patient says, "I just don't want to look tired anymore," the true reason might be mid-cheek fat pad descent, tear trough hollowing, or loss of skin tone. In other words, an emotional expression must be translated into a clear anatomical diagnosis. There are two essential principles in treatment planning. First, accurately assess the patient's personal aesthetic concern. What exactly is bothering them? Second, avoid recommending treatments solely based on your own clinical observation. Trying to fix something the patient didn't ask for often leads to dissatisfaction. Patients feel most satisfied when they feel heard and understood. That's why your treatment plan should be centered on their concern, with your professional expertise offered as a guide, not a replacement for their voice. If you've made it this far and you're finding value in this training series, take a moment to like the video, subscribe to the channel, and leave a comment with your questions or training needs. Your feedback helps shape the upcoming lessons and makes this series even more relevant for you. Let's keep learning together. The most powerful skill an aesthetic practitioner can develop is the ability to look at the patient's face, not just with their eyes, but with anatomical knowledge. Any physician who performs injections must be capable of analyzing the face in layers and in 3 dimensions. It's not simply about saying, "Let's place filler here." The real challenge is understanding why the issue has developed and where it actually originates. During this evaluation, there are 6 key anatomical systems you must understand. Bony structure. It forms the skeletal framework of the face and serves as the foundation for all volumization decisions. Retaining ligaments. These suspensory systems help prevent facial sagging. Fat pads. They define the volume and contour of the face, but shift or diminish with age. Mimetic muscles. These are the muscles responsible for facial expression, and their overactivity can lead to dynamic wrinkles. Vascular and neural zones. These are areas of vessel and nerve passage that must be recognized before injecting to minimize complication risks. Skin architecture. Its thickness, elasticity, and collagen levels directly influence your treatment plan. With aging, these structures undergo distinct changes. Volume loss in the temporal region causes the brows to drop. Descent of the malar fat pads results in under-eye hollowness, dark circles, and deepening of the nasolabial fold. Volume loss in the submalar area leads to a more squared lower face and often contributes to jowl formation. These changes don't just affect aesthetics. They cause the face to appear older, more fatigued, and at times asymmetrical. A practitioner who lacks this anatomical insight will only try to fix what's visible, but the root cause remains unresolved. In this training series, we'll examine each structure one by one, and step by step, you'll learn how to clinically evaluate the aging face and build treatment plans grounded in deep anatomical understanding. The human face is naturally asymmetrical, but most patients are unaware of this before treatment, and very often when they look in the mirror after the procedure, they may say, "One side looks lower than the other." This can lead to unjustified dissatisfaction, and in some cases, even the assumption of a treatment error. That's why in medical aesthetics, photographic documentation isn't just an archive, it's an ethical, scientific, and legal safeguard. Here are the essential steps you must follow in clinical practice. Pre-treatment photography. Capture at least 5 angles: full face, front view, right and left profile, right 45-degree, and left 45-degree angles. Creating asymmetry awareness. Show the patient any natural asymmetries that are clearly visible. Use the photos to highlight these areas. If needed, mark them visually. This is crucial to managing patient expectations. Post-treatment photography. Take the same shots again after the procedure. This is the clearest way to document change, and it helps you support your decisions if any concerns arise later on. This approach strengthens your clinical safety, builds trust and clarity with the patient, and protects you from unnecessary explanations. Remember, sometimes one photo speaks louder than 100 words. The first consultation you have with a patient is the foundation of the entire treatment process, and asking one single well-crafted question at this stage can save time and guide you in the right direction. The question is, what bothers you the most when you look in the mirror? This simple yet powerful question gives you 3 major advantages. First, you discover the patient's true priority. A patient who says, "I want lip filler," may actually be bothered by an overall tired appearance. Second, it helps you assess the potential risk of body dysmorphic disorder, or BDD. The patient may be fixated on a very small, insignificant detail. In such cases, performing a procedure will only increase dissatisfaction. Third, it allows you to bridge the gap between your clinical solutions and the patient's expectations. A treatment plan must never be disconnected from the patient's own concern. Your expertise only holds value when it aligns with the patient's actual need. Always remember, if you suspect BDD, no matter how persistent the patient may be, do not perform aesthetic procedures. This is a red line, both for patient safety and ethical responsibility. Patients often come to you with a direct request for a specific treatment. For example, I want to fill my nasolabial lines. One of the most common mistakes in these cases is to treat only the area the patient points to. But your role as a clinician is not just to hear what the patient says, it's to understand why they're saying it. Here's the clinical truth. The most common reason for pronounced nasolabial folds is volume loss in the malar region and a decrease in cheek support. In other words, those lines are a result of the mid-face shifting downward. As the face succumbs to gravity, the weight pulls lower, and while the problem begins above, the patient feels its effect below. The correct planning should follow this sequence. First, add volume to the cheekbone area. This lifts the face upward and redefines the mid-face structure. Second, restore volume balance in the mid-face. This softens the cheek contour and the nasojugal region. Third, perform a minimal touch-up to the nasolabial area. Only if needed, gently soften the remaining line. This approach leads to a more natural appearance, a lifted, youthful facial effect, longer-lasting satisfaction with fewer interventions. Always remember, in aesthetics, the goal is not simply to erase a line, but to understand why it formed in the first place. Don't just treat the symptom, treat the source. An effective and well-balanced aesthetic treatment plan can never rely on a single product or technique. To evaluate the face holistically and to properly address multiple needs, the triple approach model should be the foundation of your planning. 1. Neurotoxins, botulinum toxins. These reduce the activity of facial expression muscles, preventing dynamic wrinkles from forming or deepening. They are especially effective in areas with repetitive movement, such as the forehead, glabella, between the eyebrows, and crow's feet. Neurotoxins are also used strategically to preserve facial proportions, for example in masseter reduction or gummy smile correction. 2. Dermal fillers. They restore the volume that naturally diminishes with age. By targeting areas like the cheeks, temples, chin, and under eyes, they recreate natural contours. Fillers help improve facial proportions, support symmetry, soften static wrinkles, and can create a lifting effect in the mid and lower face. 3. Skin quality treatments. Using techniques like mesotherapy, PRP, or skin boosters, these treatments stimulate subdermal metabolism. They boost collagen and elastin synthesis, enhancing skin elasticity and hydration. They offer supportive solutions for fine lines, dullness, and uneven texture. These three systems complement one another. Treatments focused solely on wrinkles, volume, or skin quality often remain incomplete or isolated, but a combined and well-structured facial plan is far more effective, both in achieving a natural look and ensuring long-term success. Thanks to social media, interest in aesthetic procedures has skyrocketed, but this training series is designed for true professional practitioners, and it will move forward with a clinical foundation and a scientific perspective. This video was the very first lesson in our professional training series. In the next lesson, we'll walk through the history of botulinum toxins, their mechanism of action, the different products on the market, dilution techniques, and dosage calculation, step by step. After that, we'll dive into facial muscle anatomy, injection strategies for the forehead, glabella, and crow's feet, possible complications, and how to prevent them, all supported with case analysis. Don't forget to subscribe and keep following this educational series.